is the ACL Reconstructive Postoperative Rehabilitation Protocol. On the day of surgery, you will use ice or cold therapy over your leg for 15 minutes every 1 to 2 hours. Please ensure that there is a towel between the skin and the cold therapy unit to prevent a freeze burn. Begin taking the pain medication as soon as you get home. Do not wait until you are in severe pain before taking it. Begin eating with liquids and light foods and progress your diet slowly over the next 24 hours. Until the first post-operative appointment, you want to keep the dressings on and dry. Usually the first post-op appointment is between 7 and 10 days after surgery. You can bathe and shower, but you want to keep the dressings dry and the bandages on. You should use crutches as instructed at the preoperative visit. You should wear the brace locked straight in extension. You may unlock it to perform any exercises. For weight bearing, please consult with your doctor to determine whether your meniscus was repaired or not, because that will dictate whether you can bear weight on your leg or not. Do not drive until instructed to do so. Please contact a physical therapist to begin formal physical therapy, usually after your first postoperative appointment. It is normal to experience some swelling in the knee and leg. Keep your leg elevated above the level of your heart. Please do not put a pillow behind your knee, as this can cause problems getting your knee straight. The rehabilitation protocol is divided up into 4 phases. There's the early postoperative period, and then phase 1, 2, 3, and 4. In the early post-op phase, from 0 to 2 weeks, the goal is to control pain and swelling. You will start physical therapy, doing active and passive range of motion, straight leg raises, quadriceps isometrics, and patella mobilizations. You must wear the brace at all times, locked in extension when walking. Straight leg raises are demonstrated in this picture. You want to lift your leg about 2 feet off the ground and hold it for 10 seconds. 3 sets of 10 should be adequate. Quad sets involve tightening your thigh muscle and holding it for 5 seconds. 3 sets of 10 should be adequate. Make sure this is done in full extension with the brace locked. Patella mobilizations involve moving the kneecap back and forth, holding it for 5 seconds. Doing 3 sets of 10 will prevent scar tissue to form. This is a harder exercise to do until the bandages are removed at the first postoperative visit. Heel slides help gain knee flexion. As the picture demonstrates, you want to bend the knee and slide the heel towards your buttock. This can be assisted by using a towel to pull your foot. Bridging involves putting a towel underneath your heel, trying to get full leg extension, holding this position for 5 to 10 minutes. Calf pumps involve moving your ankle up and down to encourage blood flow and reduce the risk of a blood clot. In phase 1, from week 2 to 6, the goal is range of motion to 120 degrees, healing of the ACL, quadriceps control, and good patella mobility. Physical therapy will involve all of the following: range of motion, straight leg raises, quadriceps isometrics, patella mobilizations, wall slides, leg presses from 0 to 80 degrees, core, hip, and ankle strengthening, step-up program, proprioception, modalities, and home exercise. We wean the crutches on average of 2 weeks when normal gait is achieved. In phase 2, the goal is range of motion to normal patella mobility, restore normal gait, ascending stairs with good control, and returning to normal activities of daily living. Physical therapy will involve active assisted range of motion, leg presses from a 0 to 90 degree arc, step-ups and downs, lunges, squats, stairmaster, and elliptical, proprioception with a balance program, a hip core program, straight leg raises, various other modalities, and a home exercise program. Phase 3, from 12 to 20 weeks, the goal is descending stairs with good control, improving flexibility, and running at 4 months. Physical therapy advances to a progressive squat program, advanced to a quadriceps hamstring program, proprioception training, agility exercises, elliptical, stretching, modalities, and home exercise program. Phase 4 is beyond 20 weeks. The goal is to return to sport-specific activity and to return to competitive activity within 8 to 10 months. This involves physical therapy focused on continued lower extremity strengthening flexibility, forward running, and bracing for sports, according to the physician. Thank you.